Hey girlfriend, this is Jan James. Welcome to the Hope After Breast Cancer podcast, where women who have endured breast cancer learn to have fulfillment over frustration, clarity over confusion, and faith over fear. We tackle the issues that many of our sisters face after a breast cancer diagnosis, from brain fog to fear of recurrence, from menopause to sex after breast cancer. This is the place to learn how to have hope after breast cancer. So strap yourself in. Welcome to the Hope After Breast Cancer podcast. Hi everyone, it's Jan James. Oops, stop. No microphone. Let's do that again. Take 2, take 15, take 2. Okay, here we go again. Hi everyone, it's Jan James with the Hope After Breast Cancer podcast. I am super excited today to bring you a beautiful success story from one of the members of our private Sex After Breast Cancer support group that's on Facebook. And her name is Erin. Erin, I'm so glad to see you today.
Hi, I'm so glad to be here.
Thank you for being brave enough to tell your story. We're getting more and more success stories all the time, which is just making me giggle a lot. And I just love that because things are working. We're finding answers to help reclaim our sex life. So can you tell our audience a little bit just about your background as far as your diagnosis, how far out you are, that kind of thing? Thanks.
Yeah, so I just celebrated my 5 years.
Awesome.
So I was diagnosed, I was just about to turn 37. I was stage 1, ER and PR positive. I did not have to do chemo, but I am on tamoxifen, and I did treat it with I did have a double mastectomy.
Okay. And what's your menopause status?
So I'm a lucky one that I still get my period every month, like clockwork.
Okay.
But I do get hot flashes.
Okay. So lots of fun. And how are you tolerating the tamoxifen?
For the first few years, it wasn't bad, with the occasional hot flashes at night. On year 3 is when it really started. And it really manifested in more of itchy, and I had painful sex, and I just slowly realized I didn't want to have sex anymore. And then it just became kind of that downward spiral with those side effects.
Oh, all of those things are so familiar to so many of us.
I know.
I'm so sorry to say, right?
Yeah.
And just listen, the hormone blockers do not have the same effect on every woman, but many, many women suffer similar circumstances to what you did. So you and I were talking before we started the podcast that it's kind of a fun way that you found our Sex After Breast Cancer support group. So can you share that story?
Yeah, so I'm part of Young Survivor Coalition, which is another Facebook group, pretty well known. And, from time to time, I go in and ask my questions and see if anyone has gone through things. And I was just getting to a point I needed to figure out what to do and do things. And I was complaining about vaginal dryness and vaginal, painful sex and no libido, and just seeing are there people that are experiencing it? And someone responded and said, you really need to try this Facebook group, Sex After Breast Cancer. And I did, I joined, and immediately all the experts and all the guides, Jan, that you have, I just went into that rabbit hole of information gathering, and then seeing everyone talking about it so openly and talking about the different lubes that they tried and different ways that they try to increase their arousal. And it empowered me to start really asking and demanding my health professionals to help me.
Yeah. So where had you gone? Let's talk about the professionals, because that seems to be something in the oncology industry that I'd really love to see change. I'm further along than you are. I'm almost 11 years out now. And I remember it was probably 2013 when I said to my oncologist, hey, painful intercourse And she said, oh yeah, not my lane. And she wasn't being dismissive. I know her well, so she wasn't being dismissive, like, I can't help you, but she was wanting to kind of set a boundary and say, you've got to see somebody else. And I said, who? She said, well, go to your gynae,
Yeah.
and I understand she's busy saving lives, and I get that. But it was interesting. The gynae I had at that time, I feel wasn't really actually very well versed on what happens to the female body after breast cancer treatment starts. And I just couldn't get many answers either. So what was your story? Like, who did you start with? It was your oncologist?
A little bit of both. So
Okay.
I did bring it up to my oncologist, and the reaction I got from him, it didn't feel right. He basically said it was my mind, that if it hurts, my mind is not going to want to do things. So I need to find ways to relax myself.
Oh, it was, you weren't relaxed enough.
Yeah, I wasn't
Yeah.
relaxed. It was my mind. And then, just like you, I am friendly with my OB.
Mm-hmm.
And, I text her. And so she's been kind of helping me chip away at it. She recommended the laser treatment for the pain. So I did that. She recommended pelvic floor therapy. So I did that. So she's been really trying to be engaged and really help me figure this out. She did mention 2 years ago, Addie. But I was really apprehensive about it. And I was like, well, maybe I can figure out the pain part and see if that helps.
Okay. Let me rewind just a little bit, because I think women will be interested in hearing this. So when you said you did the laser treatment, was it Mona Lisa or a different type?
I think it was called Diva, but I think it's the same thing.
Or Thermiva or one of those. Yeah. There's a bunch of names for them, but in essence, they laser the vaginal tissue to help it regenerate, in essence.
Yeah. So
Right.
it's supposed to help with dryness, with painful sex, and also it's supposed to help with arousal.
Mm-hmm.
I had 3 treatments, and I think it helped with the dryness. So I definitely saw improvement for that. It also, it did help a little bit with arousal if I was physically aroused there, meaning I responded better.
Mm-hmm.
It did not help anything with the pain.
Okay.
And
So,
then,
yeah, and then you did pelvic floor, and
yeah, I did pelvic floor therapy, which helped a little bit. I was tight. So, and I learned exercises in different ways I can really make sure like I stay loose.
Mm-hmm.
Which definitely helped, because I do think it was, the more relaxed I can be,
Mm-hmm.
definitely helps.
Right. And just for those in the back, we just want to say, I feel like I'm obligated whenever we talk about pelvic floor to say, it's not about Kegels. And no, please do not hurt yourself by doing more Kegels before you're diagnosed with what's going on with your pelvic floor muscles. If you do Kegels just because you think they're the thing to do, it could make your situation worse. And so I just want you to be really cautious about that. Pelvic floor therapists, pelvic floor physical therapists, typically do manual treatment of the pelvic floor muscles internally and externally. I have my first pelvic floor appointment on October 14th. Can't wait. And so I'm just in a few weeks. So I'm excited about that. But yeah, so I think getting diagnosed about what's going on with your pelvic floor muscles is really important. If you've had children, if you've had an episiotomy, if you've had other surgical treatments that may have left scarring tissue, if your urine is leaking, it is not normal, and pelvic floor therapists can help with that. So there are all kinds of things that pelvic floor helps. So thank you for letting me do that PSA.
Yes. And
okay.
I will say it did help some. Like I said, it helped me relax. It helped loosen my muscles. I even bought a wand
right.
and a dilator kit and learned how to properly use them and how to maintain that.
Right.
So it was just all things like chipping away at it. It wasn't going away, but I was finding ways to make it a little bit more manageable, but still to the point, it just, I didn't want to have sex.
Right. And so then you mentioned Addie, which is a prescription medication, right?
It's a prescription medication. It triggers the brain. So it helps with women's libido. So it's supposed to increase arousal and desire. There's definitely, it's a medication. I didn't know if I wanted to be on another medication.
Right.
There are some things that you have to do if you're taking it to manage it, that I didn't know I wanted to do. And I just mentally, I don't know if I was there to start taking medical intervention when I was trying to see if there were things I could do that weren't as I thought were invasive. That makes sense.
Right. And I'm just checking my website. Is Addie for premenopausal women?
Yeah.
I thought that was right. Okay, I'm glad you know.
And I'm not exactly sure if surgical menopausal is part of that qualification.
Okay.
So I know not everyone can take it. I also know there's interactions with certain medications that you're on that may not be as effective.
Thank you.
So
okay. Yeah.
There's a conversation to have with your health provider.
Right. And there is another alternative called Vyleesi also that is another. There are only 2 prescription medications for.
I think that's an injection.
Lack of libido, right?
Yeah.
Right.
Yeah. That was also brought up to me too.
Okay. So that's great. So, so was it your first OB or your second OB that suggested Addie?
So that was, so what I just talked about was about a year ago.
Okay.
It got to the point where, it was something, I was coming up my 5-year mark. This was really becoming an issue. I mean, it was something that was coming up in my marriage. It was something I was feeling guilty about. I mean, all the emotions that we probably all go through.
We do. How long have you been married?
We'll be 2 years in October.
Yeah, so you're newlyweds and you lose your libido. What's up with that? That's no good.
No, and it wasn't how I wanted my marriage to be.
Right.
And then you start, internalizing it. Like, is it me? Is it, something wrong with me?
I know. Oh.
So it got to the point where I knew talking to my oncologist wasn't getting me anywhere. But he did have a physician's assistant who was younger and female, and I felt I could maybe have more of a transparent conversation with her. So, I used the way I phrased it to her was really, this is impacting my quality of life. Right. I am not having a quality of life with this. And when I said it, she basically was like, you're right. I've heard of this doctor in my hospital network that has been, doing a lot of research, understands the situation. Maybe this is someone you can talk to. So I made an appointment with this doctor. She's an OB in the Detroit area that happens to specialize with women who have had breast cancer or other forms of cancer that are on hormone therapies. And that was like the day my whole life changed.
Oh my gosh. Tell us, we can't wait.
Yeah. So, we talked a lot about what I was experiencing, what I was feeling. And then there was a really pretty thorough exam, but she was trying to really understand. There were 2 issues. One was the pain, and then the other one was libido. So she was really trying to understand where the pain was coming from. Because I was doing all these things to my pain, thinking it was coming from inside my vagina. And with her exam, we realized it was actually coming in the entryway. So it wasn't external to me. It was, it wasn't internal to me. It was external to me. So the laser treatment, the pelvic floor therapy wasn't doing anything to trigger it. So once we figured that out, the one thing that she recommended was a topical estrogen ointment that from a compound pharmacy. I was, again, very apprehensive about it because you heard from my oncologist, estrogen's bad, no more estrogen.
Right.
So what I really appreciated about it, she had me in her office. She conference called my oncologist in, put him on speaker, and the 3 of us talked to him, or the 2 of us talked to him. And he agreed to it. He said, if it's a really small amount and I'm taking tamoxifen, then he doesn't see a problem with it. And if it's going to increase my quality of life, he would support it.
Awesome.
So that was issue number one that we were going to try.
Mm-hmm.
The other thing for libido, she recommended that I try a medication called Addie. And again, from my previous interaction with my OB, I knew about it. And, you know, she told me that she's finding about 70% of her patients respond really well to it. She thinks it's something I should try. There were some things I needed to know about my lifestyle. It does lower your blood pressure, so they recommend taking it at night. So, you know, you take it the last thing you do before you hit your head on the pillow. And then if you have more than 2 drinks in a night, and they qualify what drinks are, alcohol drinks, you just don't take it. And she said it takes 3 months for it to work. And I'll notice some things within the first month, but I really can't make a decision on it until 3 months. So at this point I was like, I gotta try something like this. It's really something that's impacting my life. So I tried it. I've been on it for about 5 months now, and seeing quite some positive results. It started in the first month. I started having sex dreams again. Haven't had those in years.
Wow. Wow.
And then, you know, it's much different than I would say pre-cancer, where, you know, you want to have sex without any just, you know, arousal.
Right.
So, you know, that's still something that I you know, sometimes I do, sometimes I want to initiate it, but not all the time. But once I'm aroused, and it could just simply be a touch, I'm like, I'm ready.
That's so good. Wow.
And it feels amazing to like, it's not, you know, there's no more excuses not to do it.
Right.
There's no more like, you know, I'm engaged, I'm, you know, into it.
Yeah. Oh, that's so good to hear. So now, are there any side effects that you've been experiencing at all?
So the side effects, which I don't think they're negative, is it puts me to sleep really well.
Oh, wow.
I get a little
okay.
groggy and then I sleep hard for the whole night. You know, I might have had a dizzy spell here and there, but nothing like I can't manage. And more in the morning when I first get out of bed. But my blood pressure has been fine. Like I said, my sleep has been great.
You take it nightly then?
I take it nightly, so I keep it right by my nightstand. And right before I get into bed, I take a pill. And within 20 minutes, I feel a little bit groggy, but not like, not where I couldn't like function if I had to, right? I'm not like drugged. And then I go to sleep, and it's great. And if I have a few alcohol beverages more than I should, I just don't take it, and I can take it the next day and nothing is wrong.
Wow. So that really fits into your lifestyle as well. And your husband's happy. Everybody's happy.
My husband calls it the firecracker medicine.
How cute. Well, and that's the way it should be, right? I mean, we just have been so, I think, as a community, feeling so hopeless that we're never going to get that part of our lives back. And I'm a little giddy when I read somebody's story like yours. I reached right out to you to say, would you consider being brave enough to share your story? Because I'm hearing from more and more women that they're having great success with all kinds of different things that our experts are teaching. So that is so good. So good. So what's your big advice for the women that right now are kind of thinking that there is no hope and that they're stuck? What needs to happen?
Yeah, I think it's advocating for yourself. If you know something is wrong, like talk to all the professionals. You know, I think every doctor has their expertise, and it's just finding the one that can help you. But you're only going to get there as talking and, you know, making it clear this is affecting your quality of life. And I think trying things, even if you're apprehensive about, you don't have to stay on it, but just try things.
Mm-hmm.
Do your research, understand the true impact and side effects. I think what my advice would be.
Right. I don't want this to be self-serving. We want every woman with breast cancer that's having sexual issues to join our Sex After Breast Cancer private group, because it's got all the goods in there from all of the experts. But can you speak to the women that are in that group about what was the best way? You said you kind of went down the rabbit hole, and I totally get what you're saying, because I build the rabbit hole. I'm the lucky one that has seen every single video we've done with every single expert, but we've got them all cataloged there. What would be your advice about that, about getting the information that they need? Do they need to take some time to become educated?
I think it's just kind of skimming through and looking what is important to you. Some of the things that really struck a chord with me is when you were talking, there was some literature that you posted about painful sex and the beginning guides that you had. And I think it said something about like knowing where your pain was coming from. And that just kind of like struck a chord, like, well, maybe I don't know where my pain is coming from.
Mm-hmm.
And then just all the chatter and like everyone is talking about their experiences. I was so surprised of all the people that are on topical estrogen. It made it seem like maybe there is a discussion to have with my provider on things like that.
Right.
And just the freeness of the conversation made me feel empowered to talk about it.
Mm-hmm.
And knowing I'm not alone, it's not me. Right. And I think that was like the biggest insight I got from the group right away, is like, this is a real thing. Mm-hmm. This is like a quality of life because of my medication that I need to figure out.
Right. And one of the things we have a new expert who is a urologist and also a sexual medicine specialist. So she was explaining to me that she sees both men and women with different sexual issues. Now, the main one for men is erectile dysfunction, of course. But she explained to me, Jan, there are 22 medications that I can prescribe for a man that has ED. And there are only 2 medications for women who have trouble with libido.
Yeah.
So part of what I think we're going to start doing in our community is really encouraging our women to talk to their providers. We have to demand more research in the area of women's sexual health in order to get things into trial that can help us. We need more options. 2 is not enough if men have 22. So I think we have to keep demanding. And I think that is almost the catchphrase to say to your providers is it's a quality of life issue, because that brings it around to a whole different place where this is not just a medical problem. This is a relationship issue. This is I'm an emotional and mental issue for me. So I think you have to bring it around to that point. So I appreciate you sharing that seemed to work for you. That's really great encouragement. So that's awesome. Yeah. I am so super, it is hard for me to say how grateful I am for this group of contributing experts that are so graciously giving their time to us to help educate us and give us solutions to all of the things that have happened to us, post-treatment. And we have 28 experts now, friends, and it's growing. It's still growing. I'm still interviewing new ones all the time. So it's really exciting to see. So you can always expect more, but definitely take a look at the Sex After Breast Cancer private Facebook group, and you can find out more information in the description below for the podcast and on our website at hopeafterbreastcancer.com. Erin, thank you so much for taking the time to talk to us today.
Of course. Thank you so much for having me.
What a blessing. Oh my gosh, it's so great to hear another success story. The crowd goes wild. Ah! That's so exciting. Okay, everybody, this is Jan James for Hope After Breast Cancer podcast. We will see you next time, hopefully with more success stories. Take care. Bye-bye. Girlfriend, thank you so much for listening to our podcast. I hope you found some nuggets to encourage you and give you hope. Make sure you subscribe to the podcast. You never want to miss an episode, and we'd love to know how we're doing, so please be sure to leave us a review. Until next time, this is Jan James encouraging you to remember there is hope after breast cancer. See you next time.